Hey there and welcome. Today we're going to talk about something that can be pretty scary when it happens out of the blue, Bell's palsy. We're going to break it all down nice and simple. Okay, so picture this. You wake up, you go to the mirror, and half of your face just won't move. You try to smile, but only one side works. It's a really shocking thing to see, right? Well, that's exactly what we're digging into today. All right, let's get into our first section here, a sudden facial droop. We're going to figure out what's really causing this. So, what is Bell's palsy? Well, at its core, it's when the muscles on one side of your face get weak or even paralyzed for a little while. And that word, temporary, is super important to remember. Okay, so what causes it? It really all boils down to one specific nerve in your head getting inflamed. It's called the facial nerve. Now, think of that nerve like it's a big electrical cable running from your brain to your face muscles. When that cable gets swollen, maybe after you've had a virus or something, the signal just gets stuck. Your brain is sending the message, hey, smile, but that message just isn't making it to the muscles. Okay, up next, signs and symptoms. Let's talk about how you'd actually recognize this. Now, this is probably the most important thing to know. With Bell's palsy, it's not just a little droop by your mouth. No, it affects the entire half of your face. We're talking from your forehead all the way down to your chin. That complete weakness on one side is a really, really big clue for doctors. And, because that one nerve does so much, the symptoms can be kind of all over the place. I mean, besides the obvious droop, you might find yourself drooling a bit, or your eye might get really dry and irritated because you can't blink properly. Some people even lose their sense of taste on that side of their tongue, or sounds might seem way louder in one ear. It's crazy, but it all comes back to that one single swollen nerve. Okay, let's get to the big question, the one I'm sure is on your mind. How do I know this isn't a stroke? And that's a fantastic question. Here's the key difference. With Bell's palsy, you lose movement in your forehead on that one side. You literally can't wrinkle it. That's a huge tell. But just as important is what isn't happening. You don't have any weakness in your arms or your legs, and you're not slurring your words. If you have those symptoms, that's a whole different ballgame and a true medical emergency. All right, so moving on, let's talk about what happens next. This is your action plan. I love this quote because it sums it up perfectly. This is not an emergency, but it still needs a medical evaluation. So, it's not a call the ambulance right now situation like a stroke, but, and this is a big but, you absolutely should not just ignore it or try to Google your way to a diagnosis. You got to see a professional. So what do you do? The path forward is actually pretty straightforward. Step 1, go see a doctor. You need them to confirm what's going on. Step 2, talk to them about treatment. What are the options? And step 3, which is the most common treatment, usually means taking some steroids for a bit to bring down that swelling in the nerve. Sometimes they'll add in an antiviral medicine too. So if there's one thing to take away from all this, it's this. Bell's palsy is definitely treatable. We know what it is, we know how to handle it, and the good news is most people make a full recovery. But, and you've heard me say it before, that whole process has to start with getting a proper diagnosis from a doctor. That is absolutely the most essential first step. You see, when you understand something like this, it takes the fear out of the equation and gives you a clear plan. And that's exactly what you've done today. Knowledge really is the first step. So the only question left is, what are you curious about next?